Your authentic health has always been there. Your authentic way of feeling has always been there. We are not designed to feel stress, fear, worry, and doubt. We're designed to feel accepting, joyful, grateful, loving, loved, inspired, enthused, but our programs get in the way. But the good news is you can tap into your authentic hardwiring whenever you decide to. The same with your health. You can tap back into your authentic health whenever you create space and decide to do so. But it requires alignment. It requires aligned attention to what matters, and aligned actions. Because when you know what your true self is, when that's really clear to you, then you are aligning your attention, your actions, you're preparing for it, your thoughts with your true self, with your intention. Let's see, why is this so? But we have these old programs, these old beliefs, these old stories that are rooted in our subconscious, and they distract us from our true self, our true intention. They make us second guess these aligned actions. But aligned actions is how you get on your being, how you get on your tree trunk of purpose, intention, and authenticity. Now, this is easy to talk about, but definitely not easy to do. It really requires a lot of awareness of what's going on. But it's all there. It's already there. But the reason these programs are so strong, the reason they're not just disappearing automatically and just going away, is because they have been there for your lifetime. At some point, these self-protective behaviors and stories and emotions and beliefs, at some point they kept us safe. Every addict that does drugs and alcohol, we do it, we've done it because we want to feel safe and protected from the feelings we hate, from the negative feelings, the negative feeling of uneasiness, of despair, of hopelessness, of being less than. And these traits start in early childhood, but we use drugs or alcohol to distract ourselves from them. And we do it so frequently, it becomes a physiological addiction. You don't have to use drugs or alcohol, but there's something you've done. It could be eating, it could be being busy all the time, it could be work, it can be gambling, it can be taking care of others, codependency. It distracts us from our own feelings. But these are programmed in us from an early age, and they are not going to go away just because we want them to. We have to take actions. So the programs, these are programs. And what I would ask you to do is ask yourself at all times, is what I'm thinking or feeling right now, is it aligned with my intention and my true self? Or is it a program that's been there for a while trying to pull me away from my true intention? Is it a program or is it aligned? And that is the litmus test that will always get you back on track. But you do have programs because you're human. Every human has programs. And these programs are not your true self. And these programs will automatically stimulate feelings. And then the mind traps, the chatter, the stories we tell ourselves about the feelings. And sometimes for me, I feel the negative feeling before I'm aware of the thought that caused it. But there's almost always a preceding thought before the feeling. But sometimes you don't notice the thought. You notice, oh, I just feel crappy. And sometimes you get around a certain person and you just start feeling not good. And it's because that person triggered, they're called intrinsic memories, emotional memories, that you don't know exactly why it's triggering it. But then if you think about it, you can sometimes remember it. But the story starts running and the feeling gets worse. and this could lead to a behavior. This is true in all of the uneasy, unpleasant, suffering feelings that we experience. They're always based on a program that doesn't have to run the show.